Hi, I'm Denise Rokitka. I am a physician and I run the Young Adult and Oncofertility program here at Roswell Park. One of the things we've learned over the past couple of decades is that patients are very concerned about their fertility, and it's a huge quality of life issue. And it's often something that primary oncologists are not always discussing with patients. We want to make sure that we're offering that as an option so that patients still have the ability to have children later after their treatment. So oncofertility is a newer field that is merging reproductive endocrinologists with oncologists to sort of streamline and offer fertility preservation options to cancer patients. Most patients will come to me from their primary oncologists. Some patients have come from outside or self-referrals, which is also possible. So once they come to me, we discuss what options there are, whether that's medical therapy, whether that's cryopreservation of eggs or sperm, and then we connect them with the fertility center in the area to actually undergo that process. Oftentimes it needs to be very quickly done. So for men, it's sperm cryopreservation, so that's a pretty simple and easy process. For women, it can mean oocyte preservation or embryo cryopreservation. So for women, it's a more involved process. Obviously, they need hormonal stimulation to have their ovaries make additional follicles, that which can be retrieved and then stored. So for women, it can take up to 2 to 4 weeks to actually undergo that full process. For men, it's a day. So for men, it's highly effective. We know that sperm can be stored for quite some time without any effects on it. For women, they would have to undergo some form of IVF post-treatment. So there's obviously those restrictions in terms of success. And so I think quoted is somewhere around 30% successful pregnancies after cryopreservation. Reach out and have that consultation prior to starting therapy. It's important, and we've learned from research that even just having that conversation so they know going into cancer therapy what they're looking forward to and what kind of side effects and issues they may potentially have. So even if patients are concerned about the financial costs of cryopreservation, there are resources available through the Livestrong Foundation as well as through the Alliance Foundation, and some of that is based on financial need, but there's options, and some insurances actually cover it now too. So if you are a young adult in your 20s and 30s and newly diagnosed with cancer, I really encourage you to do your research, to look for different cancer centers, to look for clinical trials, and look for programs that are going to support you in all of the ways, not just with your cancer therapy. And even if that means just a second opinion at Roswell, that's also super important to your health.